Thank you for joining us for this meeting on the link between nutrition and cancer. And we are privileged to be hosting Michael Bukachi, who has conquered, and I mean conquered, not survived. He has conquered cancer. And we are going to hear of his experience, and he's been cancer-free for 15 years, having almost died. We're happy to have him. And I want to introduce my colleague and friend, Lorraine Oano. Lorraine Oano is a mentor. She is also an entrepreneur. And for a long time, Lorraine has also worked in insurance, and she understands if you don't take care of your health, money is going to cost you. She understands that very well. So she's an entrepreneur, and she likes what she does. So in short, Lorraine, our mentor, is an entrepreneur. She has worked for insurance for 20 years. And if you need any help with your mentoring and insurance, she's the one to go to. But she's also a good speaker and a moderator. Over to you, Lorraine, to take us through this meeting. Thank you very much for being here with us, and we really appreciate you.
Thank you very much, Dr. Alice Ojwang. I wish to welcome everybody today, and I say good evening to everybody. So we welcome you to our Health Talk session on the link between nutrition and cancer. Anytime we hear the word cancer, it is always very scary because it affects most people, and it has very heavy, it's a heavy burden financially, physically, emotionally to families, individuals, and communities. In fact, the World Health Organization just tells us how serious it is because cancer is actually the second cause of death worldwide. In 2018, 9.8 million people died out of cancer. So that makes it a very scary topic. However, we have all convened not to be scared, but to learn something about cancer. So what is it that we can do differently if somebody is diagnosed with cancer? Or what can we even do to prevent cancer? How can nutrition, and that is the main topic today, how can nutrition, that is our diet, what can we do differently to prevent cancer? We all know it is October, and October is breast cancer month. And we want to pick something out of this session today as an awareness for breast cancer, but again, for all cancers. So I wish to welcome our panelists to help us to understand how our diet can help us to control and prevent cancer. So our panelists today are one, Dr. Alice Ojwang, also known as Alice Ndong. Alice is a nutritionist or a dietitian. She's a professional in this field for the last 20 years. She lectures at the Technical University of Kenya, but also practices dietetics through her clinic, Zeni Health. Through Zeni Health, she promotes healthy living. And of course, her topic is always through nutrition, not just medicine, but through nutrition. So I welcome you, Dr. Ojwang. I know we shall benefit a lot from your presentation. Our other panelist is Michael Bukachi. Michael is a former banker who is now a life skills coach and an entrepreneurship strategist. I'm sure when you saw the invite, you saw NPC. He will help us understand what NPC is, but the C stands for conqueror. So he has actually conquered cancer and has been here for the last 15 years doing what is right, and that is what we want to learn from him. And as we said, for 15 years, so we want to listen to his story and just learn what is it he did differently that can help us all as we listen today. So if not anything, let's see what our diet and what nutrition can do for us to fight and control cancer. So let's start off with our first panelist, and that is Dr. Alice Ojwang. Very good. I see we've already started, so feel free to post your questions to both Alice and to both Dr. Alice Ojwang and Michael Bukachi. Michael, I see you. You could wave to us so that we know who our other panelist is. Very good.
Hi.
Thank you. Thank you. We see you.
Yes.
Okay, so Dr. Ojwang, are you ready to start?
Yes, I'm ready to start. And
Okay.
Let's just say what I'm talking about is not anything new. It's probably a reminder because I know people the people who actually study a lot more about nutrition are people who have had cancer. People who have chronic diseases tend to do research. And so I think I am just going to remind you, and my presentation is very simple. Today, we are going to learn more from experience, and we know that experience is the best teacher. So I'm also looking forward to learn from Mr. Michael Bukachi. So let me go flashback. 6 years ago, I was here. Cancer was not as high as now. I was away in South Africa studying for my PhD. I came back last year, and the first thing I saw coming from the airport, insurance, cancer insurance, you know? So when you have cancer, you pay money, they will take you to India or to the best hospitals, you receive treatment and surgery. My question was, why are we waiting for people to get sick and then insure them? Why can't we pay for them to get nutrition advice? Why can't we use the dietitians more? But of course, these questions I was asking myself and asking the friends around me, and it's really not anybody's responsibility to take care of me or you. You have to take care of yourself. You have to make those decisions. And some time back, we went walking with a friend of mine, and I see this tall building coming up. It's written, Cancer Treatment Center. They are buying the latest facilities for diagnosis. They are putting up big buildings. I'm sure you've seen in many hospitals around the country, and especially in Nairobi here, there are cancer centers coming up. So why are these cancer centers coming up? It's because there is an outbreak, if we can say that. The prevalence has become so high. And why is that? Is it our diet? What's going on? Is it aflatoxins? What's really going on? What's the prevalence? And so these hospitals are investing because they know if you don't do anything about your diet, you're going to get sick from cancer. And the facilities are ready for you. You see, something like coronavirus just came, the facilities are not ready, so we are struggling. But for cancer, they are ready. And believe me, if you don't take care of yourself, you're gonna have to pay for those facilities. And guess who is funding them? You. When we don't eat healthy, you and me, we don't eat healthy, we're funding those facilities. So do you want to live long enough to use those facilities? Or do you want to live long enough not to use those facilities? Choice is yours. Let's go to my presentation. Triggers of disease, that's my topic. So generally, when we become ill, there are things we are doing that exposes ourselves and triggers disease. So when these things that we expose ourselves to, which we will mention in a minute, causes what we call inflammation. Inflammation, there are things that we do that triggers the inflammation or agitates inflammation. We will come to define inflammation at the end of it, but I'm sure you know what that means. So for you to have an autoimmune condition, which are some of the conditions that trigger diseases that people say cannot be cured, including cancer, it means there is going to be a trigger, genetic predisposition, and a leaky gut. So you have those three things that will trigger an autoimmune condition. Families tend to have genes that exposes them to cancer. It doesn't mean you'll get sick. It just means that your lifestyle can trigger the autoimmune condition. So there's a saying I like to use. It goes like this: genes load the gun, but lifestyle pulls the trigger. So if you have genes for diabetes, hypertension, it's your lifestyle that's going to pull the trigger. So what are some of the dietary triggers? The dietary triggers include gluten, dairy products, meat, genetically modified foods, processed foods, and many other things that lead to inflammation and disease conditions. And we definitely have your lifestyle. And you know this, like I said, I'm just reminding you of what you know. Excessive alcohol use. And let me talk for Kenya. I don't know about the rest of the world. We have a problem of binging on alcohol. We work the whole week on Monday to Thursday. We start drinking on Friday. Friday, Saturday, Sunday. People take so much alcohol that it is definitely an excessive use of alcohol and it is not safe. There's nothing wrong with alcohol. If you take too much of it, we have a problem. Overweight and obesity, sleeping habits. Do you sleep 4 hours or 3 hours? Do you work up to 2 a.m. and then sleep then? Lack of exercise. You can sit the whole day, and it's easy to sit the whole day. And actually with this COVID, one day I found myself sitting the whole day up to about 11 o'clock in the night. I was so tired. So that's the habit we have, which is not good. Stress. Do we manage stress when we have it? Not at all. So then, of course, it's not just dietary triggers. We also have environmental triggers. This, we have toxins from heavy metals, we have parasites, and more. I remember once I had a client who had headaches and vomiting. He was so fatigued and tired. And I was wondering, what is wrong? So we tried to investigate everything. I couldn't find the answer. And then the next question was, where do you stay? He stays next to a garage. So there is fuel, and those are like, how long have you stayed there? I've stayed there for the last month, 1 month. He just got married. They went on honeymoon. They were fine. He came back. He's sick. He's sick. He's sick. Then I said, I think it's the environment. Why don't you go away for like 3 days and then see the difference? They went away for 3 days. They were fine. They came back. They were sick. So it was the environment. They moved. So some people, what you're doing, the environment is going to change you. For some people, you don't get the signs. So let's quickly fast forward to cancer. So cancer is always presented with very scary pictures. So this is a cancer molecule, and there are so many pictures representing different molecules. So cancer is a term used to describe the out-of-control division of abnormal disease cells that invade the nearby healthy tissues. The spread of cancer cells to other parts of the body is called metastasis, occurs through the lymph system and bloodstream. There are several types of cancer. I'll just quickly go through that. You have carcinoma, a type of cancer that starts on the skin or the tissue lining or covering of internal organs. You have sarcoma, a type of cancer that begins in bone cells, fat, cartilage, blood vessels, muscle, or other supportive or connective tissues. You have leukemia. Leukemia is a type of cancer that starts in the tissue responsible for blood formation, like bone marrow. Lymphoma and multiple myeloma, cancers that start in cells related to the immune system. And then we have the central nervous system cancers, those that start in the spinal cord and brain tissue. So when you hear cancer called sarcoma or carcinoma, leukemia, that is the origin. And we are going to send for you a book that actually helps you define this and simplifies it. So of course, cancer has been linked to gene mutations. Many people don't know the cause of cancers, but we know your lifestyle plays an 80% role. So cancer has been linked to gene mutations. So we all have DNAs. So these DNAs can be, and they have some other molecules that can cause mutations. So a mutated gene gives instructions to healthy cell to grow and divide rapidly. This causes a rapid progression of mutated cells. These cells do not know when to stop growing because they have lost their tumor suppression genes. Within time, mutated genes accumulate to form cancerous tumors in different parts of the body: bone, breast, prostate, stomach, and many parts of your body. So what are the top 3 habits that have been linked to cancer? And when you read about cancer, different studies show different things. Something like overweight or obesity has been linked to a lot to breast cancer. Overconsumption of highly refined foods have been linked to prostate cancer. Eating processed red meat and others have also been linked to digestive health cancers. So different foods have been linked to different cancer, but these are the top 3 that are linked to cancer. So when we eat our processed meats, then definitely we know we have a risk. And when it comes to meat production in this country, it has changed. For a long time, we used to use just normal dairy cattle that eats grass, but now the things have changed. That's no longer the case. And of course, lifestyle habits that trigger cancer. We know many of them: smoking, radiation, carcinogens, viruses, chronic inflammation, hormonal changes, and consistent lack of exercise, like we have mentioned. So in that section, I've talked about what the bad things that you do that can expose you to cancer. But now let us see what happens when you have cancer and you're being treated. Of course, studies have shown that malnutrition is one of the most common and most serious side effects of cancer and its treatment. The condition affects up to 80% of patients depending on tumor type and stage. And cancer treatment will kill you, because what happens, just when you're going through chemo, you get nausea, you vomit, your taste bud changes. So a nice meal you used to like may taste like soap, so you don't want to take it. Your appetite changes, it reduces definitely. You have mouth sores that you cannot swallow or eat food. You feel fatigued, you have diarrhea, you have constipation, and we haven't even talked the emotional stress that's going on. So this definitely affects your food intake. But what happens is nutrition is very interesting, or your body works very interestingly. On a normal day, I can just eat a regular plate of food and I'm fine. But when you're sick, your energy requirement increases, your nutrient requirement increases, and they increase by the day. So if you don't meet those nutrients, then you start to lose weight very, very quickly. I'm sure you've seen somebody sick today, they go in hospital, 3 days later, they've lost like 4 or 5 kilos. And that's because we don't eat like we should. Let's just use a number. Let's assume I need 1,500 calories a day. But then when I'm sick, just the energy requirement increases twice. So I'm sick on Monday, my energy requirement is now 3,000. I don't eat anything on Monday. But remember, I need 3,000. On Tuesday, I eat nothing. My energy requirement now is 3,500. On Thursday, on Wednesday, I eat nothing. Thursday, I eat nothing. My energy requirement is 4,500, 3 times. And so this vicious circle of malnutrition, it just worsens. So you don't meet your dietary needs for today. Tomorrow, your body requires more. You don't meet that requirement, your body breaks down. And when it starts to break down, you can see what happens. You have the infection increases, you have anorexia, altered metabolism, you cannot, impaired absorption of nutrients, and then you start wasting, and remember, you're not eating. So you have acute and chronic malnutrition, your immune system becomes even lower, you become weaker, and imagine you are weak and then they continue to give you chemotherapy. Tell me what's going to happen in a few weeks or a few days. So by knowing this, I hope that if you know this, you can eat. Because what happens when I have a patient who has cancer, most of the time I'll give them the basic nutrition and then I'll send them to the cancer expert. Who I used to have one, but when I came back, I have not seen her. But don't worry, that's not a problem. But you have to know. You have to know how to prevent cancer. You have to know if somebody has cancer, they need to know that food is the biggest help they can have. If they don't eat properly, they are just going to go down. Your vitals just keep going down. You're not going to get better. And any disease, any condition that's not managed properly only gets worse. It only gets worse. So then we have to ask ourselves, if we have a patient going through this, what do we want? And of course, the impact of malnutrition is weight loss, low energy, you start losing your muscle, you're so sick you can't walk. You also have increased risk of fractures, increased risk of hospital admissions. You went in hospital, you stayed there for 5 days, now you are even now being taken to emergency, HDU or ICU. Confusions, more infection, reduced independence, increased risk of fall, reduced mobility, and the risk of mortality is very, very high. So, and what happens is, unfortunately, most of the time, the patients always come to me when they are really sick. And when they are really sick, they already don't want to eat. And so it's really a struggle to get them out of that situation. So please, nutrition is not an emergency. So don't come when you're in the last minute, you're feeling sick. Start seeing the dietitian now before you get sick. And if you're sick, don't wait for things to get worse to go get help. Start early. So enough of bad news about cancer and treatment. Let's look at it. How can we rejuvenate your health and my health? You know the 6 natural doctors. I told you whatever I'm talking about is not difficult. It's just what you know. Fresh air, exercise, water, rest, healthy, natural diet, sunshine. How often do you go out to have fresh air? Or you just sit at home the whole day or sit in the office? We were doing an evaluation and we found that most corporate Nairobians, because of traffic, they leave the house at 5 so they can get to the office early. So 5 o'clock, they are fortunate to be in the office at 6 because they don't want to be caught in traffic. Fair enough, nobody wants to be in traffic, but you're going to sit in this office the whole day till whatever time, 6 o'clock, because you're not also going to leave at 5 because you don't want to be in traffic. So you're leaving at 7. You haven't gone out to get fresh air. You haven't walked much to get some exercise. You have not gotten any sunshine. Tell me, my friend, what's going to happen? Already by just not getting sunshine and staying indoors the whole day, your deficiency of vitamin D is very low. That affects your immune system. You start getting frequent flus and colds, and you're always treating flus and colds. That's an indication that your immune system is low. And sometimes when people work, you're so busy, you don't even want to get up to get water. And of course, you're sitting the whole day from 6 o'clock to 7. Where are you getting this rest? And did you carry food to be able to eat healthy? Do you have time to go look for healthy food? Or is it skuma wiki and ugali every day? I was talking to a friend of mine finding about, how's your better half? It's been a long time. She's like, same old brother. Skuma wiki and ugali, mala. Same thing every day. I laughed, but I was like, you know what? I hope these people can change some of these things. So we do the same thing day in, day out. You've heard of this saying of insanity. You keep doing the same thing and expect different results. That is insane. So what do you want for yourself? Do you want to rejuvenate yourself or not? These are just natural things that are provided for you for free. And when it comes to diet, I'll make it simple. Natural foods. All the foods that you consume should be natural. Semi-cooked and raw foods. Different colors of food, you know them. You have your starches as natural as possible. Of course, there is more. Very readily available in our markets. Most people want to go eat processed bread, refined starches, but you have sweet potatoes. It's much, much cheaper than eating your bread. You have your corn. And if you want to eat whole food, even when you make it into flour, it's no longer whole. It is already refined. So eat it as naturally as it came. You have your proteins, but like I say, the animal proteins now, most of them are also processed. So are you sure you're eating natural? Is it natural that you're eating? We have lots of beans and grains, lots and lots of it. Fruits, and these are pictures for Kenya. We have lots of fruits in our market, so it doesn't have to be bananas every single day. Vegetables, we have green vegetables, we have yellow, we have red, we have orange. We have a variety where this comes from. And we also have spices that we use. So just to end this session, of course, I have something for you to take home a little later after we listen to Mike. But just know all the food that you need is here. In this chart, you haven't seen sausages, you haven't seen, processed meats, canned meats, and things like that. So your health is in nature. The 6 natural doctors and your natural food that you get. And then you need to sleep, because at the end of the day, you need to rest. You need to move. And if you have stress, you have to manage your stress. So, Lorraine, I will give it back to you. Thank you very much for this session.
Thank you very much, Dr. Alice Ojwang. That is interesting. So it's about lifestyle and eating natural foods. I'm sure we have some questions for you, but we shall hold the questions. Please feel free to post them on the chat. We shall discuss that at the end of the presentation. So now, we've gotten the academic perspective, I believe tried and tested, but let us now hear a real life story of somebody who had cancer, but has been able to reverse it using natural foods, using his diet. Let us listen to the story, your story. Michael Bukachi, you have our attention. Karibu sana.
Good evening, everyone. Thank you so much, Lorraine, for giving me this space so that I can be able to share with everyone about my story. As you've heard, my name is Michael Bukachi, and I have been free from cancer for the last 15 years. In the year 2006, I was diagnosed with stage 3 Nasopharyngeal Carcinoma. Nasopharyngeal Carcinoma is what is abbreviated as NPC. And it is a kind of cancer that appears or forms at the back of your palate and at the junction of the palate and the throat. So you could also say in a layman's language that it is a head and neck cancer. Now, when I was diagnosed with cancer, or let me begin by saying how it all began. There was a time that I found myself beginning to lose breath. I was losing my hearing on my left side, and I had a sore throat that seemed to be permanent. And I went to a number of chemists, and actually at some point I tried a few chemists, then I settled on one. When I went there, they gave me some medication and they told me this should be able to clear your cancer, rather your flu within like about 7 days. And I was told to take some antibiotics for those 7 days. I took them as prescribed, but after the 7 days, the thing never became any better. If anything, it seemed to become worse. So I went back after the 7 days, and they decided to give me a higher dosage, I think, of a perhaps different medicine, which again, after 7 days, didn't work. So at this particular point, now what was happening is that now the sore throat was beginning to become more, and then I began feeling something pressing at the back of my, rather at the front of my throat. It was kind of like coming from that space, which is behind the epiglottis, that is in Swahili, Kilimi, that place around the Kilimi area. And I could feel some pressure, really strong pressure coming from there. In fact, if I put my finger inside my mouth in the buccal cavity, I would actually feel that there was something that was beginning to form and press downwards. So this alarmed me. I mean, I was like, what is this? It's like as though you are going through some extraterrestrial movie and something is growing, some animal is growing from within you. So I kind of like got a little bit more alarmed, and I was back at the chemist trying to figure out, hey, exactly what is happening to me. So at that particular point, the chemist or the pharmacist said, I think I need to refer you to an ENT specialist. And I think he went through his diary got a number of them, gave me a number. I actually called that person at that particular point. I was kind of like worried. I didn't know what was happening to me. And now the sore throat was actually now beginning to kind of like, you would say, become hot, you know, like I would feel like as though somebody had put pepper in the back of my mouth that was permanently and constantly there. So I called this guy and he told me that he was going to be at his clinic later on in the day. I was in town, Nairobi, so I actually stuck around until that particular time so that I would go to see him. So when I went to see him, he actually did some checks. He put his finger into my mouth. He took some other equipment, I don't know what they are, and put them into my mouth. More or less like the same kind of equipment the dentist would use while they're trying to figure out what the issue is in your mouth. And then he told me, okay, what I think we need to do, we need to admit you and do some biopsy and actually find out exactly what the issue is. So we quickly arranged, you know, a booking in one of our hospitals. And what, of course, they told me was that on the day of this particular procedure, I was to abstain from eating and drinking anything at least for 12 hours. Now, even before it came to that, I was already having challenges eating, given what was actually happening within my body. But nonetheless, I actually did what they said, and we got to our time with them. And the next thing I knew when I went into the procedure, I'd never been admitted before and I'd never gone through any kind of procedure. Of course, I was just told to lie on a table, and some doctor, an anesthetist, came and began telling me some stories, and before I knew it, I was out. When I came to, I was in a recuperating room. They had already done their procedure. They had cut some tissues from within me, and they were now to be put to be taken to the lab for tests. So I was told, come after about 2 weeks, you shall have your results ready. Of course, they gave me more medication to try and kind of control and manage the situation that I was in. Now, those were the longest 2 weeks of my life, because in as much as I was managing it with medication, the truth is that it was not easy, because this thing seemed to be like growing widely within me. Now, through all that time, there was not a moment in my mind, it crossed my mind, none, that it could be cancer. I just thought this is something weird, and I was kind of like, yes, worried, but not sure what exactly it was. So 2 weeks later, one day in the morning, as we were going to work, myself and my wife, we decided to stop by the hospital in the morning to get our results. So we went to the reception, and then they directed us to the lab area. And when we got there, there was this, I believe he must have been a lab technician, who, when I told him, I gave him the sheet that I was given to use to come and pick my results. So I gave him the sheet, and he looked at it, and then he said, are you Michael Bukachi? I said, yes. So he said, can I see your ID? I gave him my ID. When he confirmed it was me, he went and checked, I think, in the drawers where they keep these kind of things. And when he came back to me, he had an envelope, and he just flipped it through to me and said, sorry, you have cancer. And I was there with my wife, and I was thinking I was the most strong guy on earth. Suddenly, I looked at this guy, looked at my wife, and I felt like, you know, the world was collapsing. And very quickly, I composed myself, and I told my wife, it's going to be well. It's going to be well. Remember, at this particular time, I'm trying to understand, what did this guy just say? Did he say I have cancer, or did he say something else? I was a bit confused. Actually, I was lost. Then quietly, I took that letter. I didn't need to open it. He had already pronounced what the issue was. And I told my wife, let us go. So we went back to the parking into the car. I dropped her at a place of work. But on my way, my mind couldn't just get away from the words that had just been spoken. I have cancer. And I'm thinking, how, where? You know, I'm looking at my age. At that time, I'm not even 40. The way I had been socialized to know about diseases like cancer, these were diseases that afflict the aged people. And also, they were the diseases that afflicted perhaps people who had abused maybe drugs like alcohol or smoking and stuff like that. And it's not a question of trying to put blame or to let's say, demonize those kind of things, but the reality is that that has never been part of my history. Up to now, I've never smoked, I've never drank alcohol. So to me, I was living the perfect kind of like life. So diagnosis of cancer, how? Now, at some point I said, okay, this is what you've been told. So what do? I have to deal with it. So I bided my time. I went to work, but I couldn't do anything. I went back home. Then I came back to town. I think I was confused. I was almost moving like somebody who doesn't know where he's going or where he's coming. At 4 o'clock, I knew that was the time this guy, because many doctors usually have, I believe they are called locums in different hospitals, but around 4 o'clock was when he would go to his clinic. So at 4 o'clock, before 4 o'clock actually, I was at his clinic door. I was the first person there. So when he walked in, he found me actually in the waiting side. So he said, "Oh, hi, Michael, how are you?" And I answered him back. And I think after his assistant had done some paperwork, I was summoned in. When I got in, I gave him the letter. I didn't open it. So he sat down, he welcomed me to a seat, and then he said, let me look at this. He opened the letter and he saw the diagnosis. And for a while, he stared at the paper. Then he took a quick look at me and then stared back at the letter. I realized he was figuring out how to break the news. So I told him, "Daktari, I already know what it is. It's cancer." So he said, "Hey, how did you know that?" Now I had to explain to him now at this particular point what actually had happened earlier on in the day and how this news was broken down to me. He was actually evidently very furious. He was angry. He said, this is not the way to do it. But that's exactly how my situation or how this condition was broken down to me. Quickly he told me, all is not lost, so what we need to do, I have a number of very good oncologist friends. I can get in touch with them and we can quickly begin dealing with it. So he now began breaking it down and told me, this is nasopharyngeal cancer. I'd never heard that word before. He began explaining what that meant. And also he began telling me what stage 3 meant. So at that particular point now is when I began now coming to the knowledge and understanding of stage 1, stage 2, stage 3, and stage 4 of cancer and what they meant. And they said, we need to move very quickly because you are just on the border of stage 4. If we delay, we don't know what could happen. Now, that kind of like sent me in a spin, a whirlwind of sorts. I was worried. I was like thinking, is this the end? Because I think every time I had heard about people having cancer, it was almost always the case that we were just buying time and you knew. After some time, you'll be told that person is dead. So here I was, trying to deal with this situation. And I'm thinking, hey, am I about to go? I had 2 children at that particular point. I still have 2 children even now. My firstborn then was in class 1. She is now in 3rd year. That time she was in class 1. And my secondborn was just months short of being 2 years old. So I was thinking, these guys are going to grow up minus me. I will not celebrate, their lives, their successes, their challenges. I will not be there. Then I told myself, Michael, what are you thinking? why are you beginning to focus on things that are neither here or there? I actually had what you might call a self-talk. And I began talking myself out of that kind of mindset. Then finally I said, okay, what we're going to do, I'm going to cooperate with the doctors and see what happens. Later on, I linked up with my wife, and that was after I had been connected to the oncologists who actually made me realize that we need to move very fast. But when we got home, I think another set of panic hit me, because I'm thinking, they're telling me I'm going to go to chemo, I'm going to do radiation. The internet in 2006 wasn't as developed as it is now. So there was nothing like saying you're going to Dr. Google or anything like that. So what happened was that I decided now I'm not going to go to this chemo and radiation thing. I'm going to have to bid my time, look for an alternative. But what alternative? I did not know of any. So I resorted to praying, and I didn't want anybody to know about it. I just told my wife, and my children were too young for me to tell them anything about that. And I also did not tell any of my friends, because I think I didn't want, if I'm feeling the way I was feeling, I didn't want them to begin thinking, hey, Michael is just bidding his time on earth. But after some time, perhaps about a month or so, I had to bring in a few of my friends, and I began telling them, hey, you guys, you need to begin praying with me, because this is the situation that I am facing. Short of it is this: it took another 6 months for me to finally say I was ready. In that time, lots of things had happened. When I finally decided to go to start the chemo and radiation therapies, that was in February of 2007. And part of the reason was, now my condition was becoming worse. By this time, remember initially I said I had begun losing hearing on my left side, on my left ear. By this time, I totally had lost hearing. I couldn't hear from my left at all. It happens that the tumor was actually leaning on the nerves that communicates sound. When someone is speaking, there's communication of that sound to you so that it's processed and you're able to hear. So it so happened that it was leaning on that side heavily, that it had actually delinked that kind of nerve communication. So what then happened? I was now forced to seek treatment. Finally, I told the doctors I am ready. Of course, the other thing I kept telling them I wasn't ready before was that they had a lot of money that they were looking for. And I was thinking, where do I get this kind of money? There's also the issue of insurance. The insurance was covering up to so much, and so on and so forth. Now, looking at all the regime of what was required, I was like, I needed to do quite some gathering of, or pulling together some resources to be able to do this, financial resources. So when I started, initially the protocol was that I was going to be doing an outpatient. I was told that I was going to have chemo radiotherapy every day of the week, Monday to Friday, for 30 radiotherapy sessions. Then I would be having one chemotherapy once a week. And we started. But after doing 3 of the radiotherapies, I discovered that there were a lot of changes that were already happening within me. Some of them were happening within me, some of them were things were happening without that I could observe. So let me begin by what was happening within me. Generally, I am a dark-skinned person, but even as we started this, I became darker. Within 3 days, that was noticeable. That now I was becoming darker and darker. And then the next thing that I discovered was that my skin, particularly on my face, was beginning to crack. Now, like I said, it's a head and neck kind of like cancer. So it affects this area here. You know, like it was in this kind of area But now when you are being put on that table where they're going to do the table that has the equipment to do this process or procedure, you are put on a table facing up, and then they actually strap you on your hands, they strap your midsection and your legs. Then they use some lead coverings and they put them in those sensitive areas. They cover sensitive areas like the eyes and so on and so forth, because this thing is the radiation is kind of like something that works almost like laser beam or something like that, that is supposed to be directed. And part of the reason why they strap you is because they want you to remain in that particular position. I also noticed one thing that was very interesting. Now this is something I noticed about my surroundings. But the moment this radiologist finished setting me up, just before he put on the equipment to begin the work, he would run out of the room. He would literally dash off as though he was going for a 100-meter dash. So by the time 3 or so days ended and I began experiencing all these changes, I began thinking, hey, here, there is something that I'm not being told. So I asked him, Bona Daktari, he's a radiologist, but for you, you call him Daktari. Daktari, what is it that causes you to run away in the manner that you do? And he told me he was doing his work. For me, I'm the patient. I should cooperate. I should not ask questions. But now I was like, okay, how do I reconcile what is happening to me? And this guy is saying he's doing his work and I'm not supposed to ask questions. On the 4th day, I told him, if you don't answer my questions, we are not doing this procedure. I refused. So I think I kind of like put him between a stone and a hard place. And he just said, this is not the way we do it, but I'll let you know that radiation is so strong, so powerful, that even for him, he fears to be there at the moment this thing is put on. But he told me, don't worry, it will just affect you for a while. The issue is that we're trying to kill the cancerous cells, so it's going to be okay. Perhaps in a sense, that kind of reassured me. But, again, you can't run away from what is happening to you. So anyway, I continued with it. Before the week was over, I was given the first chemo. I did not know what hit me. My body just reacted very, very negatively to chemo. I vomited. I began feeling like, I was churning inside out and so on and so forth. So when they continued the radiation the next day, they saw, I think, things around me were becoming bad and they decided to admit me. So thereafter, just as we were finishing the first week to begin going into the second week, I became an inpatient. The rest of the procedures were now happening with me being an inpatient. The time they gave me the second chemo, I vomited so bad that I vomited green stuff. I had no idea what was happening. And at that particular point, this one I did not even ask the radiologist who was administering the chemo. I waited for the oncologist to come and I said, hey, this is what was my experience today. What happened here? And the oncologist said, oh, sorry, we forgot to tell you that sometimes you could vomit and when it comes out green, that is bile. Now, from my study of biology in high school, I was thinking, bile? Is that green stuff that we are told is usually bitter and I'm vomiting it? And they did not tell me. And I began thinking, is that supposed to be normal practice? Is it negligence or what exactly is it? I think my feelers now came on high alert. I was actually now cautious, questioning and asking everything that was happening. The short of it is that I got to a point where now I was so sure that this perhaps may not be the way I should be looking for. To make matters even worse, what happened was this, that every day they would take, the nurses would come and take clinical data, which include things like, for example, your temperature, your electrolytes, blood pressure, and so on. And they would be put on a chart or on a record, and then they would actually plot a chart, which would be put at the foot of my bed that I could see. I happen to be very good with graphs. I saw the trend on this thing was a downward trend. And I began asking myself, okay, so what does this mean? If this graph is, moving in a downward trend, where is it going? Uko chini ni wapi? Where is that down place is going to? And my mind told me, you know what you were fearing that time, that, when you hear of cancer, that it eventually ends up in death. This downward place is the pit, or in another way, we can say it's the grave. And that's the time I think I rose up and I said, no, I am not going to die. I am not going to die. In as much as I did not know what to do, I began just declaring that I wasn't going to die. I'm going to live. So they continued with that, and I thought of, I needed another option. I needed another way of looking at it. So in as much as I still remained in hospital and I was going through their treatment regime, I decided to take a very drastic measure, which I did not even tell my wife. I decided what I was going to do, I was going to fast. Now, let me get you to understand this properly. The first thing is this. Within 2 weeks now, I had come from 81 kilos to 49. That is over 30 kilos loss in 2 weeks. The last time I was 49, I was in Form 1. And I'm thinking, I was looking so bad, my eyes sank, my cheeks fell inside. If I had removed my shirt before you and showed you my chest, you could literally count my ribs one by one. You could see rib 1, rib 2, rib 2, rib 3, and so on. And here I was telling myself I was going to fast. But why was I coming to such a drastic thing? Fasting was not one of those things I really loved. I loved my food. So the idea of fasting wasn't very, very common and popular with me. So, but I said drastic situations require drastic measures. So looking at the menu in the hospital, I knew the smallest meal was breakfast. And I told myself I'm going to be skipping my breakfast. By this time, something else I should mention is that I had wounds right from my lips, my tongue, my buccal cavity, all the way to the gullet going down. So by this particular point in time, all my food was pureed. I could not take anything solid. It had to be put in a blender and pureed so that I would drink it. And these wounds were actually leaking, they were bleeding. So that notwithstanding, I decided I was going to do a fast. So what I did for lunch and my supper, every time I would be filling up my order, I always put large. It was a way of like saying compensating for missing the breakfast. And I told God this, I'm going to pray and fast for 21 days. And I don't know what that means. I just saw something like that in the Bible. But after the 21 days, I need to understand what exactly is happening to me. And I took a calendar, put it beside me, and I began ticking. Every time after breakfast, I would tick. And it went on until the 21st day. On the 21st day, I was actually out and looking and expecting for something. The time for visiting came. 10 minutes into time, nobody had come. In my time in hospital, I had people, some of them even coming before time. So the time the doors would be open, there would be like people dashing to my bed. Now this day, 10 minutes after time, there was nobody who had come. Then suddenly, some old man who later on told me that he was 70 years old, came by my bedside, he knocked, and he said, "Hello, my name is Michael Moody." He happened to be my namesake. So he said, "My name is Michael Moody, and I go from hospital to hospital praying for the sick." So he asked me if I felt he could pray for me. I said, fine. I mean, who refuses prayer? Now, at that particular point, and in the hospital that I was in, there was no cancer ward. It was just a general ward, such that in the ward, there would be like 4 beds, and there would be people of different ailments. There would be a person who's suffering, let's say, from diabetes, so another one from cancer, another one from whatnot. So he asked me, and I told him that I was there because of cancer. The moment he heard it was cancer, he suddenly lowered his voice and he began turning in the curtain. When he did so, I thought, this guy is crazy. Who is he? I don't know him. He's not a doctor or a nurse. Why is he doing that? Then he began asking me, he told me, Michael, do you want to be healed? I'm like, what kind of question is that? Then he told me, you're going through chemo, yes. You're going through radiation, yes. And you expect to be healed? Tell him, of course. Then he told me, do you know what causes cancer? I told him, even the oncologists don't seem to know. They are, to me, it appears like they are trying this and trying the other one. So how do you expect me, a lay person, not to know what causes cancer? Short of it was this. The guy told me he knows what causes cancer. I was like, okay, tell me more. Are you from the medical background, or how do you know that? This is the time the guy told me that all diseases, chronic diseases, have got a source in diet. He actually, in fact, put it this way. He asked me, do you have a car? And I'm thinking, what does a car have to do with it? So I said, yes. So he said, what fuel does it use? That time we used to have super and regular, and leaded had not yet come into the market. So I told him I was using, my vehicle was using super. So he said, okay, if you put regular, what will happen? I said, what would happen is that it would knock. Then he told me, Michael, you are knocking your body. And suddenly it connected. When it connected, he told me that you were designed to eat plant-based foods. I had a bit of an issue with that, and he actually had to show me that from the scriptures. Thereafter, I found myself in the biggest conflict of my life, in that my mind suddenly was thinking, this is the biggest rubbish kind of like story I've ever had. But my heart began telling me, hey, these other things you are trying are not working. Perhaps this is the thing you're looking for. That conflict continued with me for some time while this guy was there. And then finally, he said now he wanted to pray so that he leaves. And suddenly I had peace. And I felt that this is the thing I really wanted to do. So the guy prayed and left. So actually to me, he became the answer for my prayer and fasting for all that particular time. Now, what happened is that after that, I texted my wife and I told her, because we had agreed she hadn't come that day, she had been coming every day. I told her, I'm going to be discharged today. On that day, it was on a Sunday. So I told her, I'm going to be discharged tomorrow. And she was like, I was there yesterday and the doctors never said anything like that. So what do you mean? So I told her, don't worry, just know I'm coming home. Now she called me, you know, we were just texting each other. So she called me and she actually said she was going to come to hospital and see what's wrong. I told her, even if you come to hospital, it won't make a difference. So you just relax, just know I'm coming home tomorrow. I'll tell the doctors tomorrow when they come. Come Monday, I actually told the doctor that this is I want to do. And this, I never told them, I never mentioned about these guests that came to visit with me. And I told them that I needed to be discharged. And they said that can't happen. So Monday came past, Tuesday came past. On Wednesday, I refused to cooperate. I refused to take meals. I refused everything. And I think they got a bit scared. So what happened is that they finally let me go. Michael Moody had told me what you needed to do is when you go home, you begin grating carrots.
Just a minute Michael. I think this is where the story gets interesting, and this is where we want to get this connection that we're talking about today. So we appreciate your story. I think it has helped us to connect with the emotions that come with it. But now tell us, how does diet link to cancer control? What happened from that point?
Okay, it's actually what I was really getting into, because later on, I actually had to get somebody to properly guide me on exactly how this works. This was a lady by the name Esther Kibunja. who had actually been cured of lupus, having been given only 7 days to live. Now, Esther is the one who actually finally told me that it's not about eating the raw carrots or the raw vegetables, but juicing them. And I wanted to know what's the science behind it. So she sold me a couple of books which actually had these kind of explanations. And that's where I realized that, for example, when you're talking about carrot has got a lot of antioxidants. Now, cancers and other chronic illnesses come from accumulation of cells which have gone bad, like we were told by Dr. Alice earlier on. But now what causes that to happen that way? Now there is an environment that begins to come into your body because of the diet you've been having before that causes your cells to begin losing some ions. And they begin becoming what are known as free radicals. Now, free radicals is the beginning of the genesis of these cells, which are now unstable. When they become unstable, when you take the raw carrots or the juice, what it does, it oxidizes it and gives it back the lost ion. So by getting the lost ion, what happens is that now it becomes stable again. So when you are taking lots of these, what happens is that now all these cells that were beginning to go haywire are kind of like caught up in a place where they must begin now reversing because of the antioxidant effect that you're getting from the diet.
Okay, so carrots, tell us about the carrots and how it is an antioxidant and how it has helped you.
Okay, now there's one thing that I must say, even as I tell you about the carrots. You see all these now, the body terrain or the body environment, there is the external environment, like I think the one Alice had alluded to earlier on, but there is also the internal environment, which now begins causing this antioxidant. That is the, not the antioxidants, the free radicals. This is a terrain of acidity. Acidity, your body begins moving from the neutral kind of like balance and it begins swaying into a predominantly acidic state. So I had to first of all even know what causes the body to move into that state. And from the books that I had now been reading that I had bought from Esther, I realized that it was animal products. Animal products and dairy products. So that feeds or causes the free radical to multiply exceedingly. So the one thing that I learned from that, and also that I was guided by Esther, was that I had to stop all animal products. And I went cold turkey. That means that I stopped immediately. And I began actually now taking plant-based products. At that particular point, because I was in a state of fighting, according to my coach, Esther, I needed to take them in juice form. Juice form is the best way you actually take the raw plants. Because when you juice it, it's still raw, but it's now in juice form. And in that state, it is pre-digested for you because the juicing separates the pulp from the juice in the process of extraction. So when you drink it, it actually is fast-tracked within your gastrointestinal system. So it actually gets to all your body cells within a very short time. So that's how it actually does work. So it begins now changing the terrain, the body terrain, from acidity to alkalinity. Now, cancer cells cannot feed on an alkaline terrain. So in a sense, you are saying that you are going to be feeding, your normal body cells, but technically you are starving the cancer cells. Yes.
Good. So carrots, a lot of carrot juice, which have a lot of antioxidants, that is good. So what else? Which other foods did you feed on that helped you to reverse your cancer?
Yeah, so in all the foods or in all the juices, carrot needed to be there. But there were also other vegetables that I had to use. For example, some of the vegetables I used were things like broccoli, I used cucumber, I used asparagus, I used, I did a lot of fruits and the berries. Like for example, strawberries, blueberries. I discovered something like blueberries existed at that particular time. I never knew things like that existed. So I had to begin now, hunting where this found, and of course it was a huge shock to me to find their price. They're not very cheap. But anyway, because I knew they were going to be useful for my health, cost became a non-factor. If anything, when you go to the chemotherapy way, you know that cost is really something you do not talk about when you are trying to get cured. So there was a lot of garlic. I did a lot of garlic. I did a lot of, I even juiced cabbages, particularly the purple cabbage. I did juice as well, things like kale and spinach. Most of the fruits that I took were involved things like oranges, lemons. I mentioned grapes, avocados, and the like. I did a lot of herbs, like for example, I did things like ginger, turmeric, such that in most of my food, you wouldn't miss some of these things like pepper, green teas. I did a lot of flax seeds, lentils, chia seeds, pumpkin seeds, sunflower seeds, hemp seeds. These are actually called superfoods or super seeds. Yeah, so that's what I did.
So how long did you maintain this diet, and at what point did you get that the reversal of the cancer?
That's a good question. Besides the guidance that I got from now reading the books, the books, it will take you a while before you are able to get to whatever information you need. So the help of my coach was very important. So Esther told me that you need to do like between 12 to 16 glasses of carrot juice a day. Every day, you need to juice and drink 12 to 16 glasses. Now, because I had already seen something I forgot to mention, after I began juicing these, within 3 days, all those wounds that were on my lips, on my tongue, and in the buccal cavity were dried and gone. So that gave me confidence even in this particular regime, much as I did not quite understand much about it. I didn't understand the science then. So I was actually literally like following what I was being told by my coach, that is Esther Kibunja. Now, it was like I decided to go for 16 glasses every day. And that is like a 250 ml glass, the typical normal household glass. One such glass would be filled up, if you have a good juicer, it will be filled up with about between 8 to 10 large carrots.
Okay, that's quite a lot of carrots, eh?
In fact, we got to a point whereby I did carrots, and actually, to get back to your question, because I've just realized there's something I didn't quite answer about the question, and that was this: how long did this take? Mm-hmm. For the next 4.5 months, I was doing 16 glasses of carrots and, sometimes combinations, carrot, broccoli, carrot, asparagus, carrot. So carrot was the base in everything. So I was doing different combinations. And how I did it was that I would begin my day very early. I would begin juicing like around, by 5, I'm taking my first glass of juice. So I would make carrots that would last me for, say, about an hour, because again, you can't let it stay for long. Why? Because if it stays too long, it is exposed to air, it oxidizes. When it oxidizes, what that simply means is that it will be the juice, all right, but the potency to provide antioxidants to your cells will be gone. So you have to take it within like between 45 minutes to 1 hour. So I would make juice like about enough for about 3 or so glasses within the hour. So between 5 and 6, for example, I would have taken at least 2 to 4 glasses. Between 8 to say 10, I do another repeat, but different combinations now. And by the time it gets to about 5 or 6 there, I'm done with my 16 glasses.
Good. So you took this for 4.5 months and you got better?
Yes. What happened is this. First and foremost, it was a process, right? There was something called, at some point, it got to a point where I think I was detoxing so fast and I turned orange. Orange. You know, like color orange. Mm-hmm. My body turned orange. People were even asking me what is happening. Part of the protocol also that I was advised by Esther was to do exercises. By that time when I left the hospital, I could not walk more than 2 meters without halting to take a break. Now, as I began doing this, in less than actually 7 days, I was able to walk more than 10 meters without being supported. And I was able to do that even in a very short space of time. And I was told I needed to do this out in the sun. The idea was this: I needed to exercise, at the same time be exposed to the sunshine. There is the aspect of vitamin D and what it does. Time may not allow me to get into all that. But at the same time, because now I was told every day to be increasing my pace, it forced now my heart rate to increase. That meant that I'm exposed to the sun, I'm exercising, and I'm breathing faster. Because by doing so, what it means is that by taking higher intake of oxygen, now oxygen, you can find this out, oxygen and cancer don't go together. Oxygen actually, rather cancer actually doesn't like oxygen. So when you do a lot of breathing, it means therefore, this is going to be spread throughout your whole body. So each and every cell in your body will get a higher dosage of oxygen. And that is bad for cancer, but it's good for you.
Very good. So we get the foods you ate, the exercises, the sunshine. But then did you now go for a test to confirm that you're actually cancer-free? And at what point did that happen?
Yes, I did go for a test. Like I said, for 4.5 months, it was 16 glasses. Thereafter, I began reducing them a bit. Partly it was because it was also expensive. The carrots were fairly expensive, and sometimes, you know, they are seasonal. You find that they are very much in the market, they're not very much in the market, and so on and so forth. So I reduced to a point where now I was actually now taking 10 from 16. And that went on for the next perhaps 3 to 4 months, by which time now I went for a test. Now, when I went for a test, I found by that time that the tumor had gone down by more than 60%. Then I was so excited, and I told Esther, and Esther gave me the rebuke of my life. And she told me, don't go back there again. And I was shocked. I was like, why? And she said, you see, the equipment and the instrument, everything they're using there has to use radiation. And already you are someone who, because radiation is also one of those things that causes cancer. So you are somebody who is trying to get clean from cancer. When you expose yourself to more radiation, you actually reactivate them. So I was telling her, now, how am I going then to know that this thing is over? So she said, like, it's very simple. Like in the case, I think in my situation, I think would I say I was blessed in the sense that it was in a place I could feel with my finger. So she told me, just keep on checking with your finger in that same spot until you can't feel it anymore. And that went on. By the time I was 12 months into doing this, I didn't feel any more of that tumor at all.
Very nice. Very good. That's a very inspiring story. And of course, it's leading to a lot of questions. But before I take at least one question for you, please tell us, what lessons have you learned out of your whole journey? Just 3.
3 lessons?
Yes.
Okay. Now, what lessons have I learned out of this? I think one of the lessons I learned is that, first of all, now I began becoming conscious about health and how it's linked up with that. Before that, I never thought there was any connection whatsoever. And through the different literatures I read from time to time, because now my consciousness was heightened, I came across literature by Hippocrates. This is a Greek philosopher come doctor who lived many years BC, that is actually referred to today as the father of medicine. And this is what Hippocrates said: let food be thy medicine, and thy medicine be thy food. In other words, he was saying that when you take the right food with the right nutrition, then that food will by default become your medicine. So in other words, you do not have to become sick. So that is one of the things that I learned. And what is the other thing that I've learned? I also now learned that sometimes I think we look at things like exercise, we look at things like that, playing or stuff like that, to be things that you do when you're young. Today, I will tell you that I run, I do lots of exercises, I have got a mini gym, and my gym is not for competition purposes. I just want to keep fit and stuff like that. I came to realize that these things are not supposed to be things we do because we are passing through a stage or a phase in life. They're supposed to be, we were created to move, to act, to do things. So when we sometimes, start getting into the marketplace, it's very easy to begin living a sedentary kind of like lifestyle, because you move from home to work, back to home. And that goes in day out, week in, year in, and so on. And that is dangerous for you. And I think the last point I would say is this. In life, I came to realize that that you need to, I think I'll add another one. Let me say this one, then the next one. This is that you expect the best in life, but prepare yourself for the worst. In other words, when you prepare yourself for the worst, you know what to do when the worst happens. It means, therefore, you are ready to face all situations. So expect the best in life, but prepare yourself for the worst. The other one is that you should not approach life with a fixed mindset. Approach life ready to learn, unlearn, and then relearn. So that, don't hold things to be like fixed in the way they are. I learned this when I was young, so it always has to be that way. What if what you learned when you were young was wrong? What will happen? And it's planning up. So I think those are the points I would leave.
Very nice. I think just before I let you go, just one question. Because this is from Timothy Koech. He says, because cancer leads to muscle wasting and tissue degeneration, what we know is that you need to increase the protein intake, especially animal protein. So what did you do away with it, or what have you done about taking in animal protein, or are you only taking plant protein?
Now, that's a very good question. I have had that question like many times. I mean, I've been on this journey for the last 15 years. So you can bet it has come to me many, many times. And thank you, Timothy, for asking that question. The truth of the matter is this. Animal protein is what provides some form of, like, let's say, energy and stuff like together with starch. But what we forget is that animal protein is secondary protein. By the time you are taking the animal protein, that animal ate plant. It got its protein from plant. So by the time you are taking this protein, it is secondary protein. So the person who is actually taking animal plant-based protein is taking primary protein. So now what did I do? I now began studying and finding out which are these plants that have got high protein content. Do you know that pumpkin seeds per every 100 gram has got 5 times more protein than beef?
Pumpkin seeds, what else?
Yeah, so I discovered that there are so many plants that have got a lot of protein. Of course, we have legumes. Most of the legumes are protein dense, things like beans and stuff like that. And of course, the other thing about muscle wasting is not just because you are not eating this or the other one. It also combines very, very strongly with the level of exercise you are doing. You see, your exercises begin by, first of all, toning up your body. The next thing after toning up, they begin now building together with the foods you are taking. Now you see also the efficiencies or the level of concentration in the plant-based proteins is higher than the one that you're getting from plants. There is something called saturated fats, saturated proteins, saturated carbohydrates, and also unsaturated. The unsaturated, which are the high quality, are plant-based. They do not come from animal, meaning that the body actually maximizes on the efficiencies.
Very good. Thank you. So I think that answers a question Dr. Mary Obade was asking. Did you only take juices or did you also take solid food? So I believe with the pumpkin seeds and legumes, that was solid, isn't it?
Yes, yes.
Okay, very nice. I think that was a very, very good presentation, a real life story that we have benefited from, and it corroborates very well with what Dr. Ojwang was saying. So I guess you've let the rubber hit the road of what Dr. Ojwang was saying. So thank you very, very much. I know there are questions for you, but as Dr. Ojwang puts it all together, let's put it all together, Dr. Ojwang, for us as a beautiful take home, and we'll take maybe one or two questions. But as you do your summary, Dr. Ojwang, please answer the questions that have been raised from the floor. Okay. Thank you, Michael Bukachi.
Yeah, thank you, Michael. I've seen so many messages on Facebook and also here, and we are very grateful for sharing your life and what you've gone through. And we can see you here. So thank you so much. I think one of the things you left out is, which I would have liked them to hear is, the commitment level was so high that Michael could actually eat just a sack of carrots a week. So in 4 months, he actually had a lorry of carrots, true of us. But the commitment is so important. So before I summarize, and please feel free to ask more questions, we still have a little bit more time. But let me answer some of these questions. Leila, nutritionist, my understanding there are patients who cannot take food orally, and we do parenteral nutrition, but many of our nutritionists do not understand what do you recommend. Well, parenteral nutrition is nutrition where you're given nutrients through the nervous, through the central line, or let's say through your blood. And this is because your gut is not functioning. So Leila, the only time you actually give a parenteral nutrition is when your gut is not functioning, is when the patient's gut is not functioning. And so we should always try our best to make sure that the patients eat. No matter how sick you are, like we said, you have to eat. If you don't eat today, your demands for intake is higher the next day. Every time you don't eat, your requirement is higher. So when the patients don't eat for 3-4 days, then their guts stop working, so they can't absorb, and then you have to give the parenteral nutrition. Parenteral nutrition is more useful during surgery, when the patient is on malnutrition, and because they are going to be on nil by mouth, then it's useful. But the patient who has not been eating and is malnourished, it's not going to help much. We need to go down to business. We need to go down to natural food and feed these patients the way Michael even has shared his experience. Thank you. So the next question is from Simon Kinyanjui, and I think Michael has answered it also. Kindly comment on the China study findings on animal products being one of the major cancer predisposing or triggers protein sources. I said it at the beginning of my presentation. It's not only China. There are studies and studies and studies. And the International Cancer Research Center even goes as far as says that if you eat up to 500 grams of animal protein, then your risk of cancer is increased. And people ask me this question many times, and they say, how comes our great-grandparents, you know, our grandparents never suffered cancer, never suffered these things, they ate meat. But you know, those days, things were natural. They were very natural. Now, our meat is processed. Some of it is processed in the lab. The animals are given growth hormones. They are given antibiotics. These antibiotics get into the food system. And this is very, very dangerous for all of us. And I think not too long ago, there was a documentary on the national television. It was a very good one. It was called The White Alert. The White Alert, it was about mycotoxins, or if you say aflatoxins. And it shows how these things get into the milk, they get into the meat. And so now when you take even the milk, you get so sick. For people who have lactose intolerance, they are more reactive because it's not the natural milk. So if you're not going to eat natural food in their natural state, the way our Jehovah God created it, you are just going to trigger disease. So for meat, if you have cancer, it's a no-no. Like Michael has said, it feeds the cancer. It feeds the cancer. So it's a no-no. And I see, sometimes I see patients and they're like, oh, you can eat meat, you can eat this, but where is this meat coming from? And what do you want? So we need to read and study more. And that is why I invited Mr. Bukachi, because he reads. He knows more nutrition about cancer than a few of nutritionists put together. Thank you, Michael. And thank you, Simon, for that question. The other question is, this is a comment from Merab. Thanks, Daktari. Food really does matter. I lived with a cancer patient. What made him live longer was diet and positive attitude towards life. Beautiful presentation, thanks. Through diet, he was also able to assist almost 60 people to control the pace of cancer. But you can see from Michael's experience, you don't have to control the pace of cancer. You can conquer it. But we need determination and you need help. Note that Michael also got help from a nutrition professional. Got help from Esther. I used to send my cancer patients to Esther. I learned a few things from her. I left. When I came back, she was gone. I can't find her. I'm still trying to get hold of her. So please help us get her. Alieta. Question from Alieta. Thank you, Dr. Ojwang, for the recap. Kindly explain this. There comes a time when the patient presents multiple conditions, some of which require moderating some nutrients like reducing protein intake, severe liver failure. Let me tell you, you don't always need protein to treat patients. You don't need it at all. You need your nuts, you need your seeds, you need your beans, you need your legumes. And the only thing that gets the patient to that chronic malnutrition state is if they stay without food for a long time. The reason we have dietitians in hospitals is so that they prevent that chronic state of malnutrition from happening. So all of you listening, please share this information with your friends. It's critical. When you are sick, you need to eat more food than when you are well. And if you do not meet that intake, you start to lose weight and the body starts to break itself. Nutrient requirements increase, and because you're not meeting it, things only get worse. So please eat healthy and don't stay without eating. I have friends who say, oh, my husband is difficult. It's always about men being difficult, they don't want to eat. But that's not true. Even women, when they are sick, they don't want to eat. Children don't want to eat. But please note that when you're sick, you need to eat double the amount of food you eat for your body to recover very well. So Alieta, protein is not the answer. Natural and variety of foods. In fact, you need to remove protein because it complicates matters. Give them fresh, natural food for them to eat. Somebody asked a question here, Ruth. It's evident that many of us do 8 to 5 hours indoors without sun or fresh air. Can supplements replace this? The answer is no, no, no. Supplements is a lazy way of managing things. The problem is you're not getting sunshine, you're not getting fresh air, you're not probably going out to exercise. Supplements is not going to help you. You have got the root cause of your problem is you're not getting sunshine, you're not getting fresh oxygen. So how is taking supplements going to help you get more oxygen or fresh air? How is taking supplements going to help you get sunshine? So please, people, supplements are even actually very, very dangerous. Let me tell you, let me share some experience with you. When you take a lot of supplements, and a lot of people take supplements. So I had a client, she had anemia. The doctor sent her, Alice, please manage this blood level, is very low. And of course, I'm trying, I find out a lot of things, what she's eating, what she's not doing. I change her diet, put her on what she needs to eat to increase her blood, her blood volume. And it's not coming up. It's not increasing. Then I said, what else are you taking? Please bring everything that you're taking. This lady was taking mega doses of zinc for her hair. Because she was told, you take zinc for your hair, you take zinc for your immune system, because she was not well. But when you take high doses of zinc, it binds iron. And so you suffer from iron deficiency anemia because you're taking supplements and you're taking mega doses because you've been told. Very dangerous. Another patient was taking mega doses of calcium. They had a growth here in their thyroid. They ended up in hospital. The surgery, they could not respond to anesthesia. They gave high doses that they couldn't, so the patient did not have surgery. So the doctor demanded, what is it? What are you taking? What are you taking? The patient was taking mega doses of calcium and other supplements, and this prevented her, interfered with anesthesia. So it's dangerous, and I can tell you many, many stories about supplements. So before I put a patient on supplements, there must be need, but I do not prescribe supplements. I'm not that one who drives those sales. I prescribe food, I reduce your food bill, increase your quality of life, and prevent you from getting medical conditions. So I don't have any question, Lorraine. Is there another question for myself before I have a closing remark?
Okay, I think it's just comments, and it was quite insightful to see the connection between nutrition and cancer. That was very well done. And about juicing, I don't know, Alice, do you want to comment on that?
What's the question? I can't see it. Just read it for me, please.
Juicing, do you, no, somebody asked, do you mean you put fruits in the blender and add water, like what Michael was talking about?
I think I'd like Michael to answer that. I like the way he says it. I approve of what he's saying.
Okay.
Okay. Okay, first of all, I think I did not say that you take fruits and add water. Mm-hmm. That's what I said. I said you take, whether it's the fruits or the vegetables, you put them in a juicer, which has the capacity to extract and separate the pulp from the juice. There is no addition of water. Now, all juicers are not made equal, meaning that there are some juicers that are efficient and effective at this work than others. The best that there is in the market, to my knowledge, is called a champion juicer. Now, unfortunately, champion juicers are not locally available. I would say blessed to have gotten one from Esther, because when she was doing this kind of, let's say, nutritional advice she was giving to people, she was importing and stocking this equipment. So I bought my champion juicer from her. Right now, you can buy them online. To understand how it works, you may want to Google and put champion juicer, champion, the word champion, juicer, demonstration. You will see how it works. The way it works is that you take, it has got a motor which runs a grinder, and then this is connected through some mechanism to, some pipe where you put the you put the vegetable or the fruits, and then you plunge inside like that. Now, when you do that, it has, from the way it has been made, it separates the pulp from one side and the juice goes to the other side. Now, when you do that, because there was minimal exposure to oxygen, the potency of the antioxidants within it is at almost 100%. When you use the other juicers, you may find yourself getting anything from between 14% to less than 20%. That's the major difference. But that said, what you do, you don't want to add water to it. You rather even just get the Kenwood juicers where you just put this thing and you separate. Now also, let me quickly mention this. There's a difference between the effect of fruits and the effect of vegetables to your body. Fruits are cleansers. Vegetables are healers. When we eat food, lot of debris from the previous foods remain in the gastrointestinal system. So when you take your fruits, you should take them before you take anything else, because the enzyme content in it will dissolve and brush away that debris. Do water to help clear it, and then do vegetables, so that now it finds a cleaned up system and it's quickly absorbed to begin healing. So there are two things we are talking about here. We are talking about cleansing and healing. So you do your fruits first, and then you do your vegetables. Yes.
Thank you. Mm-hmm.
Thank you
Dr.
very much, Michael. Thank you very much. So yes, so remember, if you blend your juices, keep it out there, it's lying around for hours, it's gonna become useless. And really these juices are more, they are more beneficial if you use a blender that does not allow reaction with oxygen. So if you're healthy and you can eat your fruit whole and all those things, just use it. Diana, I can see your hand up, but unfortunately we are out of time. I have seen your question. Please mute. Sorry about that. So just to end this, we say that we know all the nutrients. You know macronutrients, your fruits, your vegetables, the large ones. You have micronutrients, your vitamins, your minerals, and you have your phytochemicals, your antioxidants, your enzymes, your carotenoids, your flavonoids, and the list is endless. So the thing is this, our bodies are constantly being exposed to things that cause illness. Constantly. In the food you eat, because of the processing and the storage and transportation, you're exposed. And of course, in the environment where you work, what you do, spending long hours without eating, spending long hours in the office without getting fresh air, without getting sunshine, without exercising. So you're constantly being exposed to conditions. So when we take the time to learn what the potential problems and how to avoid them, it is going to help you prevent disease and even reverse it. But when you don't take the interest to learn and find out, then you lose the fight to be able to prevent the disease and to be able to reverse it. Nature is the best medicine. It is the best medicine. Thy food is thy medicine, and thy medicine is thy food. You've heard about that saying. And also, one of the sayings I like is as old as 1876. If you can't make time for exercise, be ready to make time for illness. Because exercise on its own is a whole dosage of medications. My patients who are diabetic who exercise, you can just see their medication, their insulin levels, they keep dropping, they keep dropping. The more they exercise, they eat healthy and that. So these natural doctors, like we said, are your medicine. And somebody asked, how comes the doctors do not treat, do not apply this natural? Doctors, they go and learn medicine. But you are responsible for your health. So you cannot blame doctors for anything. You are responsible for your health. So what I will want to encourage you is remember this. You expose yourself to triggers, and these triggers, you make a choice. You are the one who makes a choice to eat healthy or not to eat healthy. We are only supporting you. So just remember, genes load the gun, but lifestyle pulls the trigger. Thank you very much, Ms. Lorraine, for having us.
Thank you very much, Dr. Ojwang. That was very good. Thank you for giving us the professional view. And we are very happy to see that it actually supports what Michael has been talking about. And Michael has been a real life example of somebody who's applied this, and we can see the effect 15 years later. So Michael, I hope your diet, I think maybe tell us about this. How is it right now? So that we can take, you have 2 minutes to tell us, what are you continuing to do that we can do to prevent cancer?
Okay, right now, what I do is that, let me say about my typical day, what my typical day looks like today. Well, I still do juicing, but now I only do 2 glasses a day. That is partly because I want to increase the antioxidant levels within my body, my system. Then I drink lots of water. And the way I drink water is that I always take water before meals. What I do is that I've created over time, I've created kind of like a system. When I awake, I take a glass of water. Sometimes this may need to be flavored a little bit with lemon and stuff like that. But over time, I find that I take water without having to flavor it at all. I still do a lot of salads. Most of my diet, I think I would say about 80% of my diet, even today, is made up of salads, is made up of smoothies, is made up of, things like green teas, the herbs and all that. I found a way of combining this over time so that now even my family knows, they do know how to do this. And they also do that, but they don't do it to the extent that I do. Then about perhaps 20% max would be what I would say I take in terms of solid eating.
Thank you very much. I'm sure we have all...
Sorry, exercise also is part of my routine. I mean, I do lots of exercises.
Very good. Thank you. So the natural doctors that Dr. Ojwang was talking about we've seen the practicality through your experience, and we are very grateful for this. 15 years and still going strong. You actually walk your daughter down the aisle. So thank you very much for this.
Yes.
Very nice. Thank you very much for that presentation. So we thank you all for having joined us today. We are privileged to have had you, and we trust that you benefited from this session. We shall invite you for more. I can see people asking for more like this, and you can be sure that we shall ask you to tune in when we have the next program. Thank you, Dr. Ojwang. Thank you, Michael Bukachi. Thank you, everybody, for attending, and see you next time. Have a good night, everybody.
Yes, and I would like to take this opportunity to thank you, my friend Lorraine, for moderating this session, and Mike Bukachi for giving us your experience with all your heart. Thank you, everybody, for being here. And our next one is going to be in November, and it's Diabetes Month. As long as you register, we have your email. We're going to send you a book, a mini book about cancer and cancer protocols. And we are going to send you the link, because we are going to have, we're going to send you the link. We're going to put this on YouTube, and so you can share it with your friends and family. Thank you, and have a good evening.